Right now, before you read another word, I want you to think about this morning, the exact moment you opened your eyes, before you checked the time, before you reached for your phone, before you did anything at all. Was your mouth bone dry, your tongue plastered to the roof of your mouth, nothing to swallow? A sandpaper sensation that made you need water before you could even speak your first word of the day. If that description stopped you cold, put everything else down and listen carefully to every single word of what follows. Because what your family has been brushing off as just a little dry mouth, or worse, just part of getting older, is neither minor nor normal, nor something you should wait another single day to address. My name is Dr. William Lee. For over 2 decades, senior health has been my entire world. I have sat across from thousands of patients, reviewed mountains of research, and, most importantly, I have watched this one symptom silently dismantle lives. Not in the dramatic, fast way you see on TV, in the quiet, invisible, devastating way that only becomes visible when it's almost too late. Here is what the science actually shows, and this number should stop you cold. A landmark 2022 analysis published in the Journal of the American Geriatric Society found that chronic dry mouth, medically termed xerostomia, carries a 61% statistical overlap with the 4 most dangerous health crises striking adults over 60. Aspiration pneumonia, infection that fills your lungs while you sleep. Systemic infection, bacteria from your mouth invading your bloodstream. Progressive malnutrition, starving even when you eat 3 meals a day. And medication toxicity, your own prescriptions quietly turning against you. Together, these 4 conditions cause hundreds of thousands of hospitalizations every single year in this country. And they all connect back to the symptom you woke up with this morning. I know that sounds impossible. I know you're tempted to move on. But before you do, I need you to hear what happened to Margaret. Because Margaret is the reason I am creating this content. Her story is the reason I cannot stay quiet. Type your age in the comments right now, and whether you wake up with dry mouth, yes or no. You will be stunned by how many people watching this very moment have never once mentioned this symptom to their doctor. Margaret was 71 years old, a retired school teacher from just outside Columbus, Ohio. The kind of woman who spent 34 years of her life pouring herself into other people's children, and who never ever wanted to be a burden to anyone. So when she started waking up every single morning with a mouth so desperately dry that she kept a glass of water on her nightstand just to be able to speak, she said nothing. Not a word to her daughter Linda, not a word to her doctor. She figured it was aging. She figured it was normal. 18 months. Margaret said nothing for 18 months. And during every single one of those 540 mornings, her body was screaming in the only language it had left. She lost weight without trying. 1 pound here, 2 pounds there, until her daughter noticed her clothes were hanging differently. She had trouble swallowing dry foods. Crackers, bread, anything without sauce or liquid. She got a chest infection in the spring, another in the fall, another the following winter. Each time, antibiotics. Each time, sent home. And each time, nobody asked the one question that should have been asked immediately. Why does this woman keep getting chest infections? Then came the 3rd hospitalization. Margaret woke on a Tuesday morning unable to breathe. Her lips had a faint blue tinge. Her daughter Linda called 911 with hands shaking so badly she dropped the phone twice. Her oxygen saturation had crashed to 81%. Healthy adults register 95% and above. Margaret was below the threshold where permanent organ damage begins. The pulmonologist's diagnosis hit Linda like a wall. Aspiration pneumonia, severe, developing not over days, over months. Here is what that means and why it matters to you directly. Every night while Margaret slept peacefully, bacteria from her dry, completely unprotected mouth were being microscopically inhaled into her lungs. This process is called microaspiration. It happens to every human being during sleep. But in a healthy mouth, saliva steps in as the first line of defense, neutralizing those bacteria before they can travel anywhere dangerous. Saliva contains immunoglobulin A, lysozyme, and lactoferrin, your mouth's built-in immune checkpoint. A biochemical security system that runs 24 hours a day, 365 days a year. Margaret's security system had been dismantled. For 18 months, bacteria made the journey from her dry mouth into her lungs every single night, quietly, without a single symptom severe enough to raise an alarm, until suddenly it was catastrophic. 19 days in the ICU, intubated, permanent lung damage, irreversible. And here is the detail that haunts me most. When Linda spent those 19 days in the waiting room going through her mother's medical records, she discovered that Margaret had been on 5 medications for 6 years, and not one physician had ever formally reviewed how they interacted with each other. 3 of those medications, a blood pressure pill, an allergy antihistamine, and a bladder control drug, all belong to a drug class called anticholinergics. They are among the most aggressive suppressors of saliva production in all of modern pharmacology. Margaret's dry mouth wasn't a minor side effect. It was her body sounding a 5-year alarm, and nobody, not one person in 6 years, stopped to listen. This was not bad luck. This was not a medical anomaly. This was the completely predictable outcome of a crisis affecting 30% of adults between 65 and 75, and nearly 40% of those over 75. And it traces back to 5 things that most doctors simply never clearly explain. Today I am explaining all 5, completely, plainly, and without anything left out. Number 1, saliva is not just for chewing. This is the misconception that costs seniors their health every single day. Saliva is not a simple digestive lubricant. It is one of the most biochemically complex fluids the human body produces, containing over 700 proteins, enzymes, and antimicrobial compounds. It is simultaneously your mouth's immune system, your digestive ignition switch, and your throat's protective lining. A 2021 UCSF study tracking over 12,000 seniors found that those with confirmed dry mouth were 2.88 times more likely to be hospitalized for respiratory infection within 24 months. Nearly 3 times the risk, hiding in a symptom most people dismiss before their first cup of morning coffee. Number 2, medication combinations are far more dangerous than anyone tells you. Over 500 common American medications list dry mouth as a side effect. Blood pressure pills, antidepressants, antihistamines, diuretics, bladder drugs, sleep aids. When seniors take 3 or more of these simultaneously, research from the Journal of the American Dental Association in 2023 found something terrifying. The suppression effect doesn't add up, it multiplies. 3 xerogenic medications do not cause 3 times the dry mouth. They may cause 6, 7, or even 8 times the salivary gland suppression. This is called the compounding xerogenic effect, and almost no physician discusses it during prescription reviews. Almost no pharmacist flags it at the counter. Almost no patient ever finds out until the damage is done. Number 3, dry mouth causes malnutrition even when you're eating normally. This one surprises every single patient I share it with. Saliva doesn't just help you chew. It triggers your entire digestive cascade. It contains amylase to begin breaking down carbohydrates, and it sends essential chemical signals to your stomach to prepare acid for proper digestion. Without saliva, that signal goes silent. Nutrients move through your digestive system without being properly absorbed. You can eat 3 complete nutritious meals every single day and still be slowly, invisibly starving. A 2022 Mayo Clinic study found that 44% of seniors diagnosed with unexplained malnutrition had clinically significant dry mouth that had never been identified as a contributing factor. Number 4, dry mouth is an open highway for bacteria to reach your heart, your brain, and your bloodstream. Your mouth is home to 700 species of bacteria, existing in a carefully balanced ecosystem, regulated and controlled by saliva. When saliva disappears, the dangerous species surge within weeks. And according to research published in Nature Reviews Microbiology in 2023, they do not stay in the mouth. They enter your bloodstream through microscopic gum tissue breaks and have been directly linked to heart valve infections, worsening of diabetes, accelerated cognitive decline, and sepsis in vulnerable seniors. This is not theoretical. This is documented, peer-reviewed, replicated science, and it begins with a dry mouth. Number 5. Dry mouth is almost never just one thing. In the vast majority of cases, it is your body's way of flagging something deeper that hasn't been diagnosed yet. Which brings me directly to the 7 warning signals I promised you. Pay extremely close attention to what follows, because this is the section where most doctors completely, inexcusably drop the ball. Before I give you the list, how many medications are you currently taking? Just type the number in the comments, because the next story I'm about to share is especially critical if that number is 3 or higher. Robert was 68, a retired firefighter from Atlanta. 31 years walking into burning buildings. A man built by a career that demanded toughness as a baseline requirement for survival. So when dry mouth woke him every single morning, Robert did what men like him do. He ignored it. He pushed through. 2 years passed. Then the tooth pain started. When his dentist, Dr. Simmons, looked inside his mouth, she paused before speaking. 8 teeth destroyed by aggressive decay in just 14 months. Numbers she had previously seen only in patients who had undergone radiation therapy to the head and neck. She started asking questions. She discovered that Robert's acid reflux medication, combined with his blood pressure diuretic, had been chemically stripping his mouth of all protective moisture for 2 solid years. But the teeth weren't the most frightening part. Dr. Simmons took a bacterial culture. What came back made her reach for the phone immediately. Robert's Streptococcus mutans levels were among the highest she had ever seen outside of a hospital setting. A 2023 Johns Hopkins study of 8,400 men aged 65 to 75 found that elevated oral Streptococcus mutans was associated with a 34% increased risk of a major cardiac event within 18 months. Robert's cardiologist found early arterial inflammation. Medications were adjusted. Dry mouth was treated. Robert is fine today. but he was 6 months from a potential cardiac event, and a dentist asking the right question about dry mouth is the only reason he is still here. Now, the 7 signals, here they are. Signal 1, ammonia or metallic morning breath combined with dry mouth. If your morning breath smells metallic, chemical, or vaguely like ammonia, rather than simply stale, that is a potential kidney function warning. Your kidneys may be struggling to filter waste, and that waste is finding its way out through your breath. Request a comprehensive kidney function panel from your doctor this week. Signal 2, thick, ropey, or foamy saliva. This is not the absence of saliva, it is altered saliva. This is a classic autoimmune warning signal. Sjogren syndrome, lupus, rheumatoid arthritis, all present with this specific pattern, often years before other symptoms emerge. Request comprehensive autoimmune screening. Signal 3, dry mouth only at night, fine during the day. If your daytime moisture is normal but your mornings are consistently severe, this is a direct sleep apnea pattern. Your airway is collapsing during sleep and forcing mouth breathing for hours, each hour further stripping your oral defenses. Get a sleep study. Even a home sleep apnea test can catch this. Signal 4, dry mouth combined with frequent nighttime urination. This combination is a diabetes warning, one of the most important dual symptom flags in senior medicine. Elevated blood sugar actively pulls water from every tissue in your body, including your salivary glands, while simultaneously driving increased urinary output. Request a fasting glucose test and an HbA1c test. Do not wait for your next routine appointment. Signal 5, dry mouth combined with dry, gritty eyes. This is the hallmark presentation of Sjogren syndrome, a serious but treatable autoimmune condition affecting an estimated 1 in 70 women over 60 and dramatically underdiagnosed. Left undetected, it can progress to affect the kidneys, lungs, and nervous system. See a rheumatologist immediately. Signal 6, dry mouth combined with leg or foot cramps. This combination flags a potentially dangerous electrolyte imbalance, low sodium, potassium, or magnesium. If you take diuretics, this combination can be especially dangerous. An electrolyte crisis combined with severe dry mouth creates conditions that can trigger a cardiac arrhythmia. Call your doctor this week. Do not wait. Signal 7, dry mouth that began within 90 days of a new medication. This is your body telling you, in the clearest possible language, that it requires a formal polypharmacy review. The 90-day window is precisely when anticholinergic suppression reaches its clinical threshold. Call your doctor's office and use this exact phrase. I need a formal polypharmacy review focused on my combined anticholinergic burden. Those specific words will change the conversation entirely. Now, what to do about it? 7 steps straight from my own clinical practice protocol. Step 1, the morning mouth assessment. Before you drink a single drop of water tomorrow morning, take exactly 60 seconds. Is saliva present or completely absent? Is it thin and watery or thick and ropey? Is there any chemical or metallic smell? Can you swallow without needing liquid? Write your answers down every single morning. In 2 weeks, you will have a clinical data set your doctor cannot dismiss. Step 2, the medication audit. Write down every medication you take, prescription and over-the-counter, every single one. Then look up each one and check for the words anticholinergic or xerogenic. Then bring this list to your doctor and say these exact words. I would like a formal polypharmacy review focused on my combined anticholinergic burden. Those words will transform the conversation. Step 3. Stop treating dry mouth with plain water. Plain water does not fix dry mouth. Your salivary glands require electrolytes, sodium, potassium, and bicarbonate, to produce saliva. Flooding them with plain water actually dilutes those electrolytes further. Small, frequent sips throughout the day, paired with electrolyte-rich foods, is dramatically more effective than a large glass at bedtime. Step 4. The Nighttime Protection Protocol. Elevate the head of your bed 4 to 6 inches using bed risers, not extra pillows. Run a cool mist humidifier and keep your bedroom humidity between 40 and 60%. Use a xylitol-based dry mouth rinse, never alcohol-based, immediately before sleep. Step 5. Clinically supported saliva stimulation. Xylitol gum after every meal. Sour, sugar-free candy to activate the parotid glands. Crunchy raw vegetables with every meal to mechanically stimulate saliva flow. These 3 interventions are clinically supported, cost almost nothing, and can be started today. Step 6. Your exact doctor conversation script. Use this precise language. I have been experiencing chronic xerostomia affecting my sleep quality, my nutritional absorption, and my swallowing function. I would like to discuss whether my current medications are contributing, and I am requesting a salivary gland function assessment. Clinical language gets clinical results. Step 7. Know your emergency red flags. Dry mouth with difficulty breathing. Emergency room immediately. White patches inside your mouth. Call your doctor today. That is oral candidiasis. Dry mouth with sudden confusion or muscle weakness. Call 911. Dry mouth with chest pain or rapid irregular heartbeat. Call 911. Dry mouth with unexplained fever. Same-day urgent care. Do not wait. Let me quickly address what I know you're thinking. Your doctor said it's just aging. Is that true? No. Clinically significant xerostomia is almost always caused by a medication, an underlying medical condition, or both. It's just aging is a dismissal, not a diagnosis. You have every right to push past it. Can drinking more water fix it? No. Dry mouth is a glandular function problem, not a hydration problem. You cannot water your way out of a broken pump. What if you wear dentures? This still applies, arguably more so. Bacteria colonize aggressively beneath denture bases against your gum tissue. Without saliva, you do not need natural teeth to suffer the full systemic consequences of dry mouth. Now let me bring you back to Margaret, because her story doesn't end in the ICU. After 19 days, she came home, weaker than she had been in her entire life. But Linda came home with a plan. She documented everything, every dismissed symptom, every missed medication interaction, every question that should have been asked in 6 years of appointments and never was. 2 medications were adjusted. 1 was stopped entirely. Within 6 weeks, Margaret's dry mouth was almost completely gone. Within 3 months, she had regained 7 of the 11 pounds she had lost. Margaret volunteers now at a senior center 2 afternoons every week. She hands out a laminated card her daughter Linda made, the 7 signals printed in large type. Over 200 of them given away for free by hand, one conversation at a time. And every single time someone takes one, Margaret says the same thing. I thought it was nothing. It almost killed me. Please don't make the same mistake I did. I am Dr. William Lee, and I make this content because every senior in this country deserves the complete, unfiltered truth, the kind their doctor genuinely doesn't have time to deliver in a 15-minute appointment. You should never have to fight to be heard. You should never lie in an ICU bed asking yourself whether one conversation, one answered question about a morning symptom could have changed everything. Because it could have, and it still can, starting right now. In the comments, type one word. Margaret, if you wake up with dry mouth and are taking this seriously today. Medication, if you're on 3 or more medications and will request a review. Doctor, if you are bringing this to your next appointment. Then share this with one person over 60 in your life. One person. You may be handing them something that genuinely changes or saves their health. Subscribe for more content like this. Real research, real patient stories, real clinical steps, no fluff. Bookmark this and return to those 7 signals whenever you need them. Stay informed, stay empowered, stay ahead of what's coming. I'll see you in the next one.